All right, today we're going to dive into a global health crisis that's somehow hiding in plain sight. And it all kicks off with one single statistic that is, well, it's pretty shocking.
So, let me just ask you a question to start. What do you think is the #1 cancer killer for women around the world? Go on, take a second. What's the first thing that pops into your head? For most of us, there's a pretty common answer.
And you know, in most countries, you'd be right if you guessed breast cancer. But here's the thing that's so staggering. In 37 different nations, the reality is completely different. In those places, the leading cause of cancer death for women is actually cervical cancer.
Just let that sink in for a minute. Not breast cancer, not lung cancer, it's cervical cancer. Now, what's so wild about this, and honestly so tragic, is that we're talking about a disease that is almost entirely preventable. So how in the world can it be the leading cause of cancer death anywhere?
To figure out how this is even possible, we really need to look at 3 critical failures, 3 huge gaps in our global healthcare system that have allowed this to happen. Let's really unpack the why here.
And look, these aren't just separate problems. They're all connected. It's like a chain reaction. It starts with a vaccine gap, which then creates a screening gap, and all of that culminates in this devastating resource gap. Let's break down how this tragic domino effect really works.
Okay, so first up, the vaccine gap. This is just unbelievable. Globally, only 15% of girls who are eligible have been fully vaccinated against HPV, and that's the virus that causes almost all cervical cancers. That leaves a massive 85% of them completely unprotected from the get-go.
So why is that number so low? Well, a huge part of it comes down to geography and policy. Some of the world's biggest countries, we're talking India, China, Indonesia, they still don't have national HPV vaccination programs up and running. I mean, that's hundreds of millions of people without access to this really basic preventative tool.
So if that first line of defense, vaccination, is missing for so many people, the next logical step is early detection, right? But that's exactly where we hit the screening gap. Think about this number for a second. Only 36% of women, globally, have ever been screened for cervical cancer. Not once a year, once in their entire lives.
And that shockingly low number starts to make a whole lot more sense when you find out that 63 countries don't even have official screening guidelines. Period. If there's no national policy, there's just no system in place to catch this disease early. It's that simple.
And this brings us to that third and final piece of the puzzle, the resource gap. And this number, well, this number says it all. A staggering 90% of all new cervical cancer cases and deaths happen in low and middle-income countries.
So here's the crucial point. It isn't just about one missing piece of the puzzle. These countries often lack the entire foundation, the basic healthcare infrastructure you need for widespread vaccination, for consistent screening, and of course for effective treatment. It's a total system failure.
So we've gone through the why. Now let's pull out a map and try to understand the where. Where in the world is this crisis hitting the hardest?
When you look at the data, the map tells a very clear story. The highest rates are all bunched up in a few key regions: Eastern and Sub-Saharan Africa, and then parts of Central and South America. These are the absolute epicenters of this crisis.
And this is not just some abstract trend on a chart. In countries like Zimbabwe, Malawi, and Zambia, cervical cancer isn't just a threat, it is the single biggest cancer killer for women. Full stop.
But the most extreme case, the place where this crisis is at its absolute worst, is the small nation of Eswatini. It has the highest cervical cancer rate on the entire planet. And the number is it's almost hard to wrap your head around. 96 cases for every 100,000 women. It's a public health emergency of an unbelievable scale.
Okay, we've seen the why and we've seen the where. But all of this leads to the most important question in this whole explainer. The so what? Why should this particular crisis grab our attention when there are so many others out there?
Because of this one fact, cervical cancer is nearly 100% preventable. I'm just going to pause for a second, because that fact changes everything we've just talked about. It turns this whole thing from a tragedy into a massive injustice.
So how do you stop it? It's remarkably straightforward. Since pretty much all cases come from HPV, a simple 2-part strategy can basically eliminate the disease. Vaccinate the young, and screen adults regularly. That's it. The tools to end this already exist.
The science is totally clear. We could virtually wipe this cancer off the face of the earth. And yet, here's the devastating reality. Most countries are nowhere near being on track to meet the World Health Organization's goal of eliminating it by 2030.
And that leaves all of us with one final, unavoidable question. This isn't a problem of science anymore. It's a problem of will, of resources, of equity. If a cancer is almost entirely preventable, why on earth aren't we preventing it for everyone?